on being elected as the new Liberal members of Parliament for Toronto Centre and York Centre. Through her over 3 decades of work as an award-winning journalist, Marcy brings a passion for advocating for vulnerable communities. And as a successful small business owner, Yara has first-hand experience of what our businesses are facing during this pandemic. Both Marcy and Yara are dedicated, progressive community advocates who are committed to making the lives of the people in Toronto Centre and York Centre even better. We look forward to having both these strong women join our progressive team as we work to support our communities and to build back better. Over the past few days, we've seen record cases of COVID-19 across the country, and it's a cause for concern. Behind each new number is a friend, a parent, a neighbor, or a senior. People's lives are at stake, and we all need to do our part. So follow your local public health guidelines, wear a mask and keep a safe 2-meter distance from one another, and download the COVID Alert app. It's easy, it's free, and with over 4.8 million downloads, it'll help you do your part to protect your friends and loved ones. Together, we will get through this. De 2 mètres et téléchargez l'application gratuite Alerte COVID. Since the pandemic started, many folks have found themselves working from home. And in cases where they've needed to self-isolate, most Canadians have been able to do so because they have a roof over their heads. But imagine if you didn't have a home, especially during a Canadian winter. Sadly, that's the reality for far too many Canadians, and our government is taking action to change that. Since 2015, we've created a national strategy to make housing a priority. There are more details about how this funding will be used. The Rapid Housing Initiative will be equally split between the major cities stream and the projects stream. Right now, our largest cities face a growing need for safe and affordable housing. We're investing $500 million for immediate support to build long-term housing for municipalities that have the highest demand. We've also opened up applications for the second half of funding through the projects stream. Today's announcement is part of our commitment to eliminate. Canada is now in the second wave of this pandemic. That comes with new challenges for small business owners, and as I told the Canadian Chamber of Commerce yesterday, we're stepping up to help, as we have since day one. Earlier this month, we announced that we would strengthen the programs that have been a lifeline for small businesses by introducing an extended wage subsidy, which covers up to 65% of eligible wages. Business owners like Steve and Cami of Steve's Poke Bar in BC will be able to keep their employees on the payroll. For support on rent, the new Canada Emergency Rent Subsidy will go directly to businesses, not to landlords. And those who have to close temporarily because of a local public health order will be eligible for an additional 25% support. That brings the total of 90% of rent covered for the hardest hit businesses. And to help cover other costs, we've expanded the eligibility for the Canada Emergency Business Account while increasing the total amount to $60,000. Depuis hier, les entreprises qui exercent leurs activités à partir de comptes bancaires personnels ont maintenant accès aux prêts accordés dans le cadre du compte d'urgence pour entreprises canadiennes en ouvrant un compte commercial auprès d'une institution financière participante. En ce qui concerne les autres mesures, comme la subvention salariale et la subvention pour le loyer, on va déposer un projet de loi sous peu. J'espère que tous les députés de la Chambre des communes se joindront à nous pour adopter cette mesure d'aide cruciale pour les entreprises canadiennes. I'd like to end this morning by taking a moment to recognize all of the women and men across the country who keep Canadians fed. Our government is here to support them just like we have been since the start of the pandemic. Today, Minister Bibeau will outline how people in BC can apply for the Emergency On-Farm Support Fund. People in other provinces will also be able to apply soon. Le Fonds d'urgence pour les mesures de soutien à la ferme de 35 millions de dollars est déployé province par province pour aider les exploitants agricoles et assurer la santé et la sécurité des travailleurs agricoles d'ensemble du pays. La ministre Bibeau va en parler plus longuement plus tard aujourd'hui, mais on va continuer de faire notre part afin de soutenir les gens qui travaillent fort pour nous permettre de nourrir nos familles. Merci beaucoup. Je cède maintenant la parole au ministre Hussein.
Now more than ever before, we have to ensure that each and every Canadian has a safe and affordable place to call home. And our government's new rapid housing initiative is doing exactly that, and it is an urgent response backed by a significant federal investment of over $1 billion. Our team at the Canada Mortgage and Housing Corporation is ready to get funding out the door very quickly through two separate streams as the existing properties into housing and to purchase land for rapid housing construction. We will work together with our partners.
Based on the latest national data, over the past 7 days, there were on average almost 1,070 individuals with COVID-19 being treated in Canadian hospitals, including 224 in critical care, and an average of 28 deaths were reported each day. Il y a eu 220 213 cas de COVID-19 au Canada, dont 9 973 décès. À l'échelle nationale, il y a près de 26 000 cas actifs. Selon les derniers chiffres à l'échelle nationale, des laboratoires de partout au Canada ont analysé les tests de dépistage de plus de 75 000 personnes en moyenne quotidiennement, dont un peu plus de 3 % ont reçu un résultat positif. Hier, 4 109 cas au total ont été signalés au pays. De ce nombre, 1 686 étaient des cas accumulés au cours de la fin de semaine et 2 027 étaient de nouveaux cas enregistrés hier, à l'exception de l'Alberta, qui n'a pas encore signalé à l'échelle nationale les cas de lundi. Cela porte le nombre de cas signalés quotidiennement à presque 2 700. Le nombre de personnes souffrant de symptômes graves augmente également. Au cours des 7 derniers jours, en moyenne, près de 1070 personnes atteintes de la COVID-19 ont été traitées dans les hôpitaux canadiens, y compris 224 en soins intensifs et 28 décès signalés quotidiennement. Though the pandemic continues to play out differently across Canada, there are many similarities when it comes to the factors that contribute to the spread of COVID-19. During the spring wave, the virus was our biggest challenge. There were many unknowns, including which public health measures were most effective to bring the infection rate down to manageable levels. Now we have much a better understanding of how the virus behaves. Our challenge now is in adapting our behavior to not give this virus any opportunity to spread. Bien que la situation liée à la pandémie continue de se dérouler différemment dans l'ensemble du Canada, les facteurs contribuant à la propagation de la COVID-19 comportent de nombreuses similitudes. Lors de la vague printanière, le virus était notre plus grand défi. Il act quickly to control the spread. But these are not the only settings where COVID-19 is se concentre à la détection de ces éclosions pour qu'elles puissent agir rapidement pour contrôler today are a reflection of exposures and infections that occurred up to 2 weeks ago. In some areas, we are learning that gatherings during the Thanksgiving weekend contributed to the elevated case counts we are seeing today. Our actions matter. La Dr. Tam et moi-même avons aussi mentionné que les cas signalés aujourd'hui correspondent aux expositions et infections survenues jusqu'à 2 semaines auparavant. Dans certains secteurs, nous apprenons que les rassemblements tenus pendant la fin de semaine de l'Action de grâce ont contribué au nombre élevé de cas que nous enregistrons aujourd'hui. Nos gestes comptent. The solution is simple. Implementing it is difficult. But the choice is clear. We must consistently maintain effective public health measures, stay home if we have symptoms, even mild ones, wash our hands frequently, maintain physical distancing, and wear a mask as appropriate. Letting down our guard and letting this virus win is not an option. La solution est simple, sa mise en œuvre est difficile, mais le choix est clair. Nous devons maintenir constamment des mesures de santé publique efficaces, demeurer à la maison en cas de symptômes,
Thank you. Merci. Première question, Christy Kirkup, The Globe and Mail. Line open.
Good afternoon. Hello, can you hear me? Hello, can you hear me?
We can hear you.
Yes, go ahead again.
Okay. Thank you for your patience. Prime Minister, you clearly have continued confidence in RCMP Commissioner Brenda Lucki, but one of your own cabinet ministers disagrees with her assessment of the RCMP's response to violence faced by Mi'kmaq in Nova Scotia. What concrete evidence do you have from the RCMP and from the
Canadians and with all Canadians to reduce systemic racism? We will continue to work with the Commissioner, with the members of the RCMP, and with all institutions that serve Canadians to reduce systemic discrimination and racism throughout our country.
Following up, Kirsty.
And Indigenous experts, Prime Minister, say the Correctional Service of Canada cannot be trusted to tackle the impacts of systemic racism, including the greater number of racialized Canadians who are institutionalized. What specific steps will your government take to hold the CSC accountable?
Oui, bonjour, M. Trudeau. J'aimerais vous entendre à propos de la décapitation du professeur Samuel Paty en France. Pourquoi n'avez-vous pas commenté l'affaire ou au moins appelé Emmanuel Macron, qui, comme vous le savez, fait en ce moment l'objet d'attaques virulentes et d'appels au boycott dans le monde musulman? J'aimerais savoir, est-ce que vous êtes solidaire de la France quand elle plaide qu'au nom de la liberté d'expression, il doit être permis de caricaturer Mahomet?
D'abord, nous avons et nous allons continuer d'exprimer notre solidarité avec la France suite à cet attentat terroriste haineux. La décapitation, le meurtre de Samuel Paty est absolument inacceptable et injustifiable et nous nous joignons à parler à des leaders mondiaux, des leaders communautaires, des leaders de la communauté musulmane ici au Canada, pour comprendre leurs inquiétudes, leurs préoccupations, pour écouter et pour travailler pour réduire ces tensions qui, dans un moment de pandémie et d'angoisse et de tensions élevées, ne doit pas avoir d'autres tisons pour accroître les flammes.
Alors, dois-je... Excusez.
Obviously, as we have and as we will continue to do, we strongly condemn the heinous terrorist attack, the murder of Samuel Paty, which was unacceptable and absolutely unjustifiable. We will continue to stand with France as it reels from this terrorist attack on an individual and on shared values. At the same time, we are seeing a rise in tensions, in anger, around the world that need to be countered, that need to be reduced, that need to be listened to and worked through. We're in a time of a global pandemic where anxiety is up, tensions are up, people are frustrated, people are fearful. We need to work together to work through our differences, to listen to each other, and to go beyond the frustrations that people are feeling. That's why I will be reaching out to fellow leaders, but also to leaders in various communities, including the Muslim community here in Canada, to talk about how they see the situation and foster greater understanding and listening.
Et en sous-question, M. Trudeau, est-ce que je dois déceler dans vos propos une sorte de critique envers M. Macron qui a parlé de séparatisme islamiste? Mais plus généralement, je voudrais vous entendre, certains font un lien entre cette affaire et celle à l'Université d'Ottawa sur le mot en haine. Certains disent que dans les deux cas, on a puni un professeur pour avoir abordé un sujet qui dérange et que c'est seulement une différence de degré dans le fond. Vous, faites-vous ce parallèle? Que pensez-vous de ce parallèle qui est fait? Merci.
Ce qui s'est passé en France, c'était un acte de terrorisme des plus haineux. C'était inacceptable, injustifiable et je pense que c'est complètement différent de tout autre acte. Nous devons d'être solidaires et de toujours se tenir debout contre ceux qui s'attaquent non seulement aux individus, mais à notre société, à nos valeurs. C'est ça la lutte contre le terrorisme et sur ce point-là, nous sommes de tout part avec nos alliés français.
Thank you. Operator, one last question over the phone.
Thank you. Merci. Prochaine question, Catherine Lévesque, la presse canadienne. À vous.
Oui, bonjour, M. Trudeau. J'aimerais aller dans cette même veine, surtout sur l'Université d'Ottawa, parce qu'à chaque fois qu'on vous a posé une question sur cette affaire, bon, vous avez choisi de dénoncer le racisme, mais je voulais savoir qu'est-ce que vous pensez de ce qui est arrivé précisément à Mme Lieutenant Duval et la dénonciation.
De la discrimination et du racisme dans la rue, dans leur vie, dans les systèmes qu'ils rencontrent. Nous devons d'être à l'écoute de ceux qui sont blessés par l'utilisation, même non avec des bonnes intentions du mot haine. Et à ce niveau-là, je pense qu'il y a certainement des leçons à en tirer dans un milieu académique et ailleurs sur comment essayer de comprendre la réalité de vécu de bien trop de Canadiens.
En suivi, Catherine?
Oui, pour revenir sur l'annonce d'aujourd'hui, bon, j'ai un peu du mal à comprendre comment 500 millions de dollars vont réellement aider les plus grandes villes du Canada.
Communities and municipalities have been using to repair, revitalize, and build new housing. So this is in partnership with that. But I can tell you that this particular rapid housing initiative is targeting municipalities and communities that have been asking us to help them acquire distressed properties, convert them into rapid housing, and to enable them to also invest in innovations that can result in the construction of rapid housing in a matter of months and not years, and to also house people that they've been able to house temporarily through our federal Reaching Home program, to move them from that temporary housing into rapid housing. This rapid housing initiative will allow them to do exactly that.
Merci. On va maintenant passer dans la salle.
Bonjour, M. Trudeau. Louis Blouin de Radio-Canada. Je veux savoir comment vous expliquez votre perte d'appui quand même hier dans les deux élections partielles. On a vu que Mme Paul a quand même bien fait, que les conservateurs sont concurrentiels dans la banlieue de Toronto. Est-ce que c'est un signe pour vous que des élections plus tôt que tard, ce serait préférable pour vous d'un point de vue stratégique? Mais aussi, j'aimerais ça vous entendre sur votre explication sur peut-être cette baisse d'appui qu'on a vue hier.
Évidemment, je suis très content d'accueillir deux femmes fortes à la Chambre des communes qui remplacent deux hommes qui étaient les députés auparavant. C'est une autre pas vers l'avant, vers l'équité dans notre Parlement. Des élections partielles, c'est toujours particulier. Dans des périodes de pandémie, c'est encore plus particulier. Je veux juste vraiment remercier tous les bénévoles, tous les candidats, tous les gens qui ont sorti, appuyé, participé et voté dans des élections partielles, dans une situation difficile, parce que ça démontre à quel point nos institutions sont fortes et notre démocratie continue de bien fonctionner. Et je suis très, très content de pouvoir accueillir deux femmes incroyables en Marcy Ian et Yara Sachs à Ottawa pour continuer le bon travail que nous faisons en tant que gouvernement. I also want to highlight that it is with tremendous pleasure that we welcome two strong women in Marcy Ian and Yara Sachs to their seats in the House of Commons to replace two seats vacated by men. So we're steadily moving towards a more gender-equal parliament. But mostly, I'm excited to have these two individuals who are strong, powerful, compassionate members of their communities stepping up to contribute.
With an even darker winter on the horizon. So what responsibility do you and your government take for the COVID-19 fatigue that so many Canadians seem to be experiencing?
We are in an unprecedented global pandemic that really sucks the way, and it does mean we have to continually remind ourselves to follow public health advice. But I know Canadians can get through this together. And yes, we've seen rises in cases here and there. We've also seen flattening of the curve in other places. We know we can do this. We've done it before. And it's frustrating to have to explain to your kids in many parts of the country, like here in Ottawa, that we're not going to be trick-or-treating this weekend. And it's frustrating knowing that unless we're really, really careful, there may not be the kinds of family gatherings we want to have at Christmas. My 6-year-old asked me a few weeks ago, Dad, is COVID-19 forever? I mean, he's in grade 1. This was supposed to be his big year as a big boy, and they're not even singing in his classroom. This is really difficult. It's a time where we need to do the right thing. We need to lean on each other. We need to use all the tools we can. And we're not always going to be perfect. And we're going to have to rely on extraordinary frontline health workers, rely on community supports, rely on a government that, as we've said from the beginning, will continue to be there to support people who need to stay home, to support businesses who have to close. It's the only way we get through this. But we will get through this. Support so that provinces can close where they need to. And all of us trying to deliver more tools to Canadians so that they can do their part. From masks to social distancing measures to an app that's already been downloaded almost 5 million times right across the country, that thousands of people have used to notify friends and strangers that they should probably get tested. This sucks. It really, really does. But we're going to get through it by doing what Canadians always do, by pulling together, by working hard, and by knowing that better days are coming. C'est plate, ce qu'on est en train de vivre maintenant. Vraiment, là, il n'y a pas aucun d'entre nous qui veut être ici dans des conférences de presse avec des masques, avec des explications sur plus de cas dans nos CHSLD, plus de cas dans nos écoles, plus de restrictions qui viennent nous brimer, nous limiter, nous embêter dans notre vie de tous les jours. Il n'y a pas personne qui voulait cette pandémie, mais nous l'avons. Et de ne pas vouloir être dedans, ça ne va pas le faire disparaître plus vite. Nous devons tous de faire notre part. Puis on ne va pas être parfait, et oui, les gens vont faire des erreurs, et il va y avoir du mauvais jugement ici et là. Mais si nous voulons vraiment le faire, et si nous faisons de notre mieux, nous allons pouvoir passer à travers. Les provinces et les territoires sont là pour amener des recommandations sur quoi fermer, quoi ne pas faire, où ne pas aller, qui devrait rester chez eux. Le gouvernement fédéral, comme on a promis depuis le début, on est là pour appuyer les gens. On est là pour appuyer les entreprises. On est là pour appuyer nos aînés, nos jeunes, nos familles. On est là pour envoyer les forces armées, la Croix-Rouge quand c'est nécessaire. On est là pour aider. Et tout le monde va faire notre part. On a des outils de plus pour les Canadiens. Plus d'équipements de protection individuelle. On a une application gratuite qui va aider à empêcher les éclosions. Alors, téléchargez-la. On a plus en plus de compréhension, comme le Dr New a dit, sur comment on va pouvoir passer à travers. Et on va passer à travers. Dans les mois à venir, on s'attend à commencer à recevoir des vaccins. Mais l'hiver s'en vient. La saison des grippes s'en vient. Ça ne va pas être facile. Mais on va passer à travers. En prenant soin les uns des autres, en étant là les uns pour les autres, en faisant notre part du pays, pas pouvoir se rassembler avec nos familles, même si on fait vraiment attention dans les semaines à venir. Mais peut-être Mais on sait que le printemps s'en vient. L'été s'en vient. Et on va pouvoir travailler ensemble. On va pouvoir bâtir un Canada encore plus fort. On a pu protéger beaucoup de gens. On a pu protéger beaucoup de nos petites entreprises, de nos institutions. Et quand on aura contrôlé ce virus, on va pouvoir revenir plus fort que jamais. Mais d'ici là, nous devons endurer. Nous devons faire notre part. Now, speaking to Canadians from one end of the country to the other, I have a responsibility as a federal leader to govern for all Canadians. And what we're seeing is situations that are very different in different parts of the country. Public health officials on the ground who know what is necessary in their community, what is needed in their community. So there is no one message we can give to everyone. Well, there was one message we could give to everyone in the spring. That was everyone stay home. Everyone don't go to work. Everyone lock down. And that worked in the spring as we flattened the curve. But now in the second wave, we have a better understanding of COVID-19. We have better tools to deal with COVID-19. And we can be a little more targeted right across the country, regardless of the situations, regardless of the advice and the restrictions that have to be brought in by public health. We could have a simple, unified message, everybody stay home, but nobody wants that. So we have a more targeted approach that prend un message très simple pour tout le monde. Mais dans la deuxième vague, on a des connaissances approfondies, on a l'expérience de la première vague, on sait là où des foyers d'éclosion ont plus de chances d'arriver et quel genre de comportement peuvent réduire les risques, et on peut avoir une approche beaucoup plus ciblée, ce qui aide énormément de gens et de communautés. Donc, non, on n'a plus un message pour tous les Canadiens. Il y a des messages appuyants quand on doit fermer, quand on doit faire des sacrifices, en s'assurant qu'on est là les uns pour les autres. C'est comme ça qu'on va s'assurer que quand on passera au-delà de cette crise, on va pouvoir rebâtir rapidement et même mieux qu'avant. C'est ça l'engagement qu'on a pris en tant que gouvernement fédéral, et on va continuer de travailler avec les provinces et avec tous les Canadiens pour faire tout ce qui est nécessaire de façon ciblée pour pouvoir passer à travers.
Hello, Prime Minister. It's Annie Bergeron-Oliver with CTV National News. Yesterday, the procurement minister said that Canada could be at risk of not getting a vaccine in a timely manner if the Conservative opposition motion passed, which it did. Is your government alleging that big pharmaceutical...
There are more tragedies to come, and we need to be there for each other, and we need to try and keep them as low and infrequent as possible with everything we know, as possible way. In regards to the Conservatives' motion, it was expressed to us by a number of important private sector actors that there are concerns around competitiveness, around confidentiality of contracts, around things like that. And we're going to work, as we always do, to be as transparent as possible without putting at risk Canadians or their well-being. This is something that all Canadians expect of their government and of parliamentarians, and we will work with Parliament to try and ensure that we're getting as much information to them as possible, while at the same time not putting at risk Canadians. There is a tremendous amount of interest in vaccines around the world, and companies have choices. But we're going to make sure that Canadians get the safe vaccines that they need to get through this crisis. And we will continue to be transparent and open with Canadians about how we do that.
Hi, Prime Minister. Tom Perry with CBC. I'd like to ask you about the COVID Alert app. BC and Alberta have not signed on to it. Dr. Bonnie Henry out in BC yesterday was talking about...
Not many Canadians would be likely to download it because of privacy concerns. And doing a better job of pinpointing moments of exposure and moments of testing so that the app can be even more accurate, and it's not alerting people who were exposed well before someone tested, and that's a change that is very much in the works. And I hope that people in Alberta and BC who can right now download the app, but will only be notified if someone got tested in a different province and plugged in. I really hope that BC and Alberta listen to the many British Columbians and Albertans who would love to have this additional tool. It's not the panacea. It's not the one thing that's going to fix everything, but it is another important tool in our toolbox that has prevented thousands of cases across the country. And as we reach close to 5 million Canadians who've downloaded the app, close to a significant percentage of our population, I think it's close to 15%, we're at a place where it is having a real impact. And the more people around you have downloaded the app like you, the more you will be safe, which is why we're encouraging everyone to do it. But in the important trade-offs, we went with protecting people's privacy, protecting people's autonomy as the top desire. And even though certain very thoughtful doctors and scientists would like to know more, we feel that having the largest number of Canadians comfortable downloading it and using it is the right utilization of this app. Different countries have done different things, but I think Canadians can be proud of the approach that we've taken.
Thank you, Prime Minister. This is all the time you have for us today. Merci, Monsieur le Premier ministre.